Dr. Wolk, Dr. Grossman, we have quite a few questions that have come in. So I just read through them and try that we don't repeat that we have already covered. So, Dr. Grossman, this one is for you. What are some of the interventions for symptoms and advanced illness?
So that's a terrific question, and it's a very, very important one that we have to consider as clinicians. There are we think of a two-pronged approach. One approach involves medications, and the second approach involves managing the environment. As far as medications are concerned, we look to see whether there is a medication that can help manage some of the symptoms that will help with the quality of life of folks who have advanced illness. Sometimes folks can have hallucinations, for example, and could be very, very disturbed and upset, and we try to find a medication that can help manage this kind of difficulty that can be quite distressing. As far as the behavioral management is concerned, managing the environment, we try several strategies. We try to help with structuring the environment so that folks can feel more confident about and more confident in the reliability of their day-to-day activities, so there aren't going to be surprises and things that can be upsetting. We also try to reduce provocative agents. If there are folks, for example, who have difficulties with inhibitory control, as we talked about earlier, some individuals with FTD can be quite disinhibited and can get very upset at seeing, for example, some ads in newspapers. We try to minimize exposure to these provocative agents that can be upsetting. So we try to pursue both a modest regimen of medications as well as managing the environment to see if we can help ease the burden and optimize quality of life in folks with advanced illness.
Thank you, Dr. Grossman. There is another one for FTD. It says, one of the first steps in managing behavioral symptoms in FTD is identifying the problem. How can one keep track of symptoms?
Well, that's a great question as well, and Dr. Wolk addressed that also when he was discussing the fact that many of the things that we see in neurodegenerative conditions like FTD or Alzheimer's disease really can occur in folks who have healthy aging, and the trick is trying to figure out at what point these subtle things that we see all the time start becoming more challenging and worrisome. And this can be difficult because these are very, very subtle things that we're trying to look at. Word finding difficulty is extraordinarily common as we get older, and an exaggeration of word finding difficulty can become aphasia. There can be some personality quirks that we may develop as we get older, and an exaggeration of these can represent behavioral variant of FTD. As far as memory is concerned, benign forgetfulness or senior moments can become exaggerated and can be some of the earliest features of that can suggest that Alzheimer's disease may occur in the future. What I try to counsel folks that I see in clinic is to look for these kinds of changes that are occurring consistently and to the point where they're starting to interfere with normal everyday functioning, and to keep a log of these unexpected or unusual behaviors so that you can monitor whether these are occurring consistently, and bringing these into your doctor to discuss is I think the best way to manage some of the detection of early symptoms of FTD and neurodegenerative conditions.
Thank you, Dr. Grossman. The next question is, can the doctors talk about deep brain stimulation, and at what stage one must opt for it? Dr. Wolk, would you like to take that?
Sure. So deep brain stimulation, which involves implanting an electrode in the brain to either stimulate a part of the brain or to kind of turn off a part of the brain that's over-functioning, is something that's been used really in Parkinson's disease, which is a type of neurodegenerative condition that can be associated with cognitive impairment, but is not the type of condition that we've been sort of talking about as much today. There's some other kinds of motor disorders that are also treated with deep brain stimulation. For Alzheimer's disease, there's no approved treatment for deep brain stimulation, but it's interesting that the question came up because there has been some interest in using deep brain stimulation to stimulate the memory network in the brain and see if that could offer a benefit in patients with Alzheimer's disease. And we actually participated in a trial like that where a sort of part of the memory network, the electrode was implanted, and it was to try to turn on or enhance that network. And it was a small trial, largely for safety, although we were also looking at outcomes with regard to thinking. And I must say the results were somewhat mixed, but there was some promise with it that there actually is a larger study that is going to occur in the relatively near future that will look at this to see more definitively whether or not it makes a difference. There have been a few other trials as well with different approaches to where to stimulate the brain. But right now this is really just purely a research tool that's being tested for its clinical efficacy, not something that we routinely would do as part of clinical care or practice.
Thank you, Dr. Wolk. The next question is, my father had Alzheimer's, my mother had FTD. Are there tests that could give me an idea of my risk? And is there a medicine or supplement that could promote brain health? Dr. Grossman?
So that's also a very great question to be asking, particularly with regard to FTD, where there is a substantial risk for FTD being inherited. We find FTD inherited in about 15 to 20% of the folks that we see in clinic, and so we're oftentimes asked exactly this question. What we do, our first step, is to take a detailed family history. If FTD is inherited, we see that it's inherited in a particular way so that there's somebody in every generation who's a direct relative has a form of FTD. So if a child is worried about FTD, they would see it in the mother or the father, and perhaps in the mother's or the father's brothers and sisters, but you would also see it in if it's, for example, if the mother has FTD, you would then look to see if the mother's mother or father also has FTD. Then the pattern of inheritance, there should always be somebody who is a direct ancestor of the person who's concerned who has FTD. So doing a detailed family history of that sort can determine whether someone is at risk for having FTD. If there is a history of FTD in a parent, but not in that parent's parents and not in that parent's brothers and sisters, the risk is in fact very low. So the first step to try to figure out about family history or the risk of inheritance is to study family history. If the family history is higher, then what we do is we tend to refer to a genetic counselor and discuss the family risk in more detail. And for some of the more common inherited causes of FTD, we can do a blood test to try to see whether it in fact is inherited. We're able to identify the specific change in the genetic code that is associated with FTD.
Thank you, Dr. Grossman. Dr. Wolk, would you like to comment on that from an Alzheimer's perspective?
Yeah, sure. So I think Alzheimer's is a little bit different. There certainly are genetic risks, and I mentioned the gene that is probably the biggest risk factor for Alzheimer's disease, called the apolipoprotein E gene, and the what's called the E4 variant of that gene is associated with a couple-fold increased risk of the disease. We all have two copies of it, and actually if you have two ApoE4 genes, which is actually quite uncommon, you have a maybe even 5 to 10 times increased risk of the disease. However, age is by far the biggest risk factor and dwarfs really any of the genetic risk. And the other risk factors that are things that can contribute to the likelihood of developing the disease actually include a lot of cerebrovascular risk factors and cardiovascular risk factors, so high blood pressure, high cholesterol, obesity, and diabetes. And so all those things are contributors. I think we as a field are not quite where they are in cardiology, where we have a risk score that we could give someone, but I think we're very close to getting to that point, and there are some calculators out there for determining your risk. With regard to genetics, there are places that if people want to get genetic testing like 23andMe, they can, and they will get returned ApoE results. I might suggest that would be better to be through a conversation with your physician. And as a final point, there are, as I mentioned, these preclinical trials in people who don't have symptoms but may have risk, where they would do some of this testing as part of a study. And I think if someone is concerned and has has a history or family history, then that might be an opportunity for them in a more controlled environment to determine their risk to some extent, as well as an opportunity to try to intervene if that's something they want to be kind of aggressive about at that point.
Our next question is, what is the best method or activity to maintain brain health, if there is one? So, Dr. Grossman and then Dr. Wolk.
Well, I think that there is now very good evidence in the medical literature to suggest that physical exercise and mental exercise are both very important at being able to maintain brain health. There is a concept that's called cognitive reserve, and the cognitive reserve concept is that we can enhance our healthy living and maintain our brain health by having high education, high occupational attainment, and engaging in significant midlife activities. And so all of these things really speak to the fact that being active cognitively is very, very important. There's also good data to support the claim that a moderate amount of exercise on a weekly basis is really a good way to maintain brain health.
Dr. Wolk?
I completely agree with everything Dr. Grossman said. I think if anything, there's the strongest data for exercising your body as protecting your brain, even more so than some of the data with brain games and things of that nature. I think some people might get caught up in some of these kinds of things that you see advertised about various brain games and things like luminosity and some of these other kinds of tools, where to me it's still a little less clear about any specific brain game that's helpful, other than, I would say, more broadly, to try to keep yourself mentally stimulated and doing things that you enjoy. So if it's crossword puzzles you like, do crossword puzzles. If it's reading you like, do reading. But keeping as engaged as possible, I think, is important. And actually social engagement also, maybe for the same reason, has another thing that has been shown to seem to stave off the development of cognitive decline.
Thank you, Dr. Grossman and Dr. Wolk. We are actually at the end of our hour. Over 10 million people in the U.S. have a neurodegenerative condition, and half of these people have Alzheimer's disease, making it the most common neurodegenerative condition in the U.S. Among the remaining, a large population suffer from frontotemporal dementia. However, FTD and Alzheimer's are very often misdiagnosed for each other, and even the terms are used interchangeably. We have seen in the last 1 hour how they're different and how it is important to receive targeted therapies for the same. So Dr. Grossman and Dr. Wolk, thank you very much for your time and for sharing all this information with us. Pat,
thanks so much,
for participating.
Yeah, thank you.
Thank you, Pat. Thank you, Patricia, for participating and sharing your experience. We also thank the University of Pennsylvania and the audience. The talk will be available on curetalks.com. Please visit our website for details on upcoming talks. Thank you, everyone. Have a great evening.